Good evening. Today we are discussing about two small topics regarding pediatric nursing. First one is anthropometric assessment. The second one is uh, key points in milestones. So we will discuss first anthropometric measurement. Anthropometric measurement, the main components are height, weight, chest circumference, head circumference, mid-arm circumference, BMI, skin fold measurements. Mainly we are discussing, especially in pediatric, we are discussing height, weight, chest circumference, and head circumference. First, we will see weight. The average birth weight of a baby is 3 kg. It doubles by 5 months, triples by 1 year, 4 times by 2 years, 6 times at 5 years, 10 times at 10 years. Weight of a child 1 to 6 years, we are calculating an equation, age in years into 2 plus 8. If the child's age is above 8 years, we are calculating using another equation, age in years into 3. These are the main points in weight. The normal birth weight of a baby is 3 kg, and then two equations we are calculating for weight of the child. Weight of a child 1 to 6 years, age in years into 2 plus 8. Weight of a child 8 years and above, age in years into 3. These are the main points in weight. Next we'll see height. Height at birth, the length is 50 centimeter, 3 months 60 centimeter, 6 months 65 centimeter, 9 months 70 centimeter, 1 year 75 centimeter, 2 year 87.5 centimeter, 3 year 94 centimeter, 4 year 100 centimeter. This for height also we are calculating with one equation. Height of a child beyond 1 year of age, age into 6 plus 77. This is so we'll get the height of the child. In infant, we are using infantometer for to measure length. In pediatrics, after 1 year, and even in the adult also, we are using stadiometer for height measurement. So some main points in height. Height at birth 50 centimeter, and we are using one equation to measure the height of a child. Next one is head circumference. Neonate average head circumference 33 to 35 centimeter. At 6 months, it is 43 centimeter, and 1 year it will be 46 centimeter. 24 months, 48 centimeter. 12 year, 52 centimeter. These are the main points in head circumference. Head circumference normal it is 33 to 35 centimeter. If head circumference more, in case of hydrocephalus and hydrocephalus, that will call macrocephaly. If head circumference is less than 33, we will call microcephaly. In chest circumference it is less than head circumference by about 2 to 3 centimeter at birth, around 30 to 33 centimeter. The head circumference and chest circumference equal by about 9 to 12 months of age. Both the head circumference and chest circumference are equal at 9 to 12 months of age. These are the main points in anthropometric measurement: the height, weight, chest circumference, and head circumference. So in this, they will ask maybe the normal height of a at birth. What is the height of a child? What is the normal weight of the child? So many questions they will ask. Next, we will see growth chart. In growth chart, we will measure the physical and developmental growth of the child. Physical. In infancy, 0 to 12 months, rapid physical and developmental growth. During infancy period, it is rapid growth, physical and developmental growth. The toddler, 1 to 3 years, slower growth rate with increased mobility. Compared to infancy, the growth rate is low, but the mobility, their activity is more. Preschool, 3 to 6 years, steady growth and development of social and motor skills. Their social and motor skills increase in preschool. School age, it is 6 to 12 years. Continued steady growth with more refined skills. So their refined skills will be more in school age. Adolescents 12 to 18 years. So everyone knows they will start puberty, and so some psychological changes also occur in adolescents. These are the main points in growth chart. Next, we will see another topic, key points in milestones. It's a very important topic in milestone, key points in milestone. So many questions they will ask. So first one is infancy. Infancy means 0 to 12 months. The physical growth in infancy, it is already we discussed. This is rapid growth will occur. So height, weight, head circumference grow quickly. In mainly the motor milestones, 1 to 3 months, lifting head while on stomach, 4 to 6 months, rolling over, 7 to 9 months, sitting with support, 10 to 12 months, crawling and walking with support. These are the main motor development occurs in infancy. In cognitive development, developing sensory abilities, recognizing the caregivers. So social smile, all they will start in infancy period. Next age group is toddler, 1 to 3 years. Physical growth, slow rate, but improved coordination. Motor milestones, mainly 12 to 18 months walking independently, 18 to 24 months running, climbing, 24 to 36 months walking up stairs, kicking a ball. These are the main motor development. Maybe they will ask at what age the children will walking up stairs, kicking a ball. So many questions they will ask in milestones. Next is cognitive development, toddler, language exposure and understanding simple concepts. These are the main points in toddler milestones. Next, preschooler. Preschool, 3 to 6 years. The physical growth, steady growth, increased physical agility. In motor milestones, 3 years, hopping, catching a ball. 4 years, using scissors and drawing shapes. 5 to 6 years, riding a bicycle with training wheels, complex play they will start. In the cognitive development, imaginative play, understanding time and basic maths concepts. This all different age group, they will separate, they have different plays that we will discuss in play therapy. In cognitive development in preschooler, imaginative play, understanding time and basic math concept. These are the main points in preschooler. In school age, 6 to 12 years, physical growth, slow and steady, preparation for puberty. Puberty will start at school age. In motor milestone, improved coordination in sports, developing fine motor skills like writing. In the sports, they will specialization will occur in. Maybe they will focus on running. Maybe they will focus on jumping. This is the main motor milestones occurs in school age. Cognitive development, logical thinking, academical skills, understanding abstract concepts. Cognitive development, mainly in schools, logical thinking, it will start, and we can make out they are brilliant or they are less for low in study, like that we can make out. Then adolescents, physical growth, the age group is 12 to 18 years. The physical growth, puberty growth, development of secondary sexual characteristics. In adolescents, they develop, for adolescents, the secondary sexual characteristics will develop. Motor milestones, advanced skills in sports and other physical activities, cognitive development, abstract thinking, identify formation, decision making, and complex problem solving. These are the cognitive development occurs in adolescence. So next, we will move the peculiar points in all age groups. In motor skills, infants, head control, rolling over, sitting, crawling, walking. So for this one, exam purpose only, I make it. So it is for easy to understand. For infancy, maybe they will ask head control in what ages. So we can make out this is a head control occurs in infants rolling over or sitting with support or with sitting without support, crawling, walking, all they will start in infant period. In toddlers, running, climbing, fine motor tasks like stacking blocks. Preschooler, hopping, catching, more refined play skills. The school age, advanced coordination, team sports, refined motor skills. These are the main motor skill development in infancy, toddler, preschooler, schooler. In next, language skills. In language skills, in infants, cooing and babbling and first words. So infancy period only, small children, they will make so many sounds. So the first words also like ma, pa, like that they will, the infancy periods only, they will start to talk. Toddler, vocabulary growth and simple sentences. So toddlers, they will make some simple sentences. Preschooler, clear speech, storytelling, understanding of grammar. The school age, fluent speech, complex sentences and improved vocabulary. So this we know already. The infancy, they will make some sounds only, and first they will tell small words only. In toddler, they will make small sentences. In preschooler, there will be they will speak small stories, and they can understand what we are telling. In school age, the fluent speech, and they will talk complex sentences, and their vocabulary will increase. In social and emotional skills, infants, attachment to caregivers and basic emotions. In social and emotional infants, they will focus on their caregivers only. They will afraid about the strangers. So social and emotional skills develops in infants, especially they will recognize their caregivers. Taller social play, developing independence and experiencing temper tantrums. Temper tantrums seen in toddlers. Maybe one important question is temper tantrum seen in which age group? So toddlers usually temper tantrum we can make out. Preschoolers, cooperative play, empathy and understanding rules. School age, forming friendship, understanding social norms and emotional regulations. These are the main social and emotional skills in different age group. Next, cognitive skills. In infant, sensory exploration, object permanence. Toddlers, problem solving, cause and effect understanding, imaginative play. Preschooler, imaginative play and grasping basic concepts. School age, logical reasoning, academic skill, complex problem solving. These are the main cognitive skills we can make out in different age groups. So these are the main important points in milestones, developmental milestones. Next, we will see some questions in this arthopometric measurement and keep milestones, developmental milestones, some important questions we will discuss. First question is, what is the purpose of measuring mid-arm circumference in children? Actually, mid-arm circumference is also one of the important physical measurement for to make out the physical growth. So that's why I just include this question. So for the answer is to assess nutritional status and detect malnutrition. Second question, which arthropometric measurement is used to estimate body fat percentage? Skin fold measurements, especially in adults. Adults, we are arthropometric measurement we are using skin fold measurement to estimate body fat percentage. How often should arthropometric measurement be taken for patients with malnutrition? So, weekly or bi-weekly to monitor progress. For if malnutrition patients, we have to be arthropometric measurement, we have to take weekly or twice week. Then fourth one, what is the purpose of measuring head circumference in infant? To monitor growth and development. So we can make out the proper development of brain. So if you already discussed, if maybe the anterior frontal in case of hydrocephalus, so the head circumference is increased. In microcephaly, it will be less than 33 centimeter. So this is the answer to monitor growth and development. The next question, how is body mass index calculated? BMI? This is one of the most important question. So many exams they are asking this question. How is body mass index is calculated? The body mass index is calculated by weight in kg divided by height in meter square. The sixth question is, how often should arthropometric measurement be taken for healthy adults? So for healthy adults, annually or biannually to routine checkup, we have to take the arthropometric measurement. In children, weekly or bi-weekly. Then what is the purpose of measuring height and weight in adults? To calculate BMI and assess nutritional status. For calculate what is the purpose of measuring height and weight in adults? To calculate BMI and assess nutritional status. Next question, what is the primary purpose of using growth chart? The answer is to monitor child growth and development over time. So while seeing the growth chart, we can make out the child is malnutrition or adequately get nutrition. Like that, we can make out. Ninth question, which organizational growth chart are widely used internationally? So WHO growth chart is we are usually using widely. The next question, what is the benefit of using a growth chart to track a child's weight? So what is the benefit of using a growth chart to track child's weight? It helps identify potential nutritional deficiencies or growth disorder. So as earlier we already told. So while seeing the growth chart, we can make out the child is malnourished or malnourished or not. So the benefit is using growth chart is to help by identify potential nutritional deficiencies or growth disorders. At what age is the head circumference typically no longer measured? So around 2 to 3 years of old age, after 2 to 3 years, we are not measuring the head circumference. Then because the head already, the bones already, the brain bones already fused. So brain growth already finished, completed. So we are not, after 2 years, we are not, and the anterior and posterior frontal closing, the anterior frontal closing at 2 months and the posterior frontal closing 18 months. Maximum we can read for 2 years. So after 2 years, usually we are not measuring the head circumference. If any changes only, we have to measure. Why it is essential to use the same growth chart for a child over time? To ensure accurate tracking of growth chart. So one growth chart we are using for one child. So we can make out make out throughout the growth pattern of the child. What is the purpose of plotting a child's BMI on growth chart? To assess, the answer is to assess the risk of overweight or underweight. So BMI nowadays, so the most of the children, they will eat, they are chubby, fat. Even children also, they are very fat. So for maintaining the growth chart, we can make out the child is overweight or underweight. Who should interpret growth chart data? A qualified healthcare professional only interpret the growth chart data. At what age does a child typically say their first word? So already we discussed in the milestones, the infancy period, they will start, they will make sounds and they will start with the small words. So especially the end of the infancy, so it will be 9 to 12 months. Which milestone is expected around 6 to 7 months? Sitting up. Maybe they will sit with the support or maybe they will sit without support. So sitting up, we are seeing in 6 to 7 months. What is the typical age range for crawling? 7 to 10 months. At what age do children usually start combining two words? Combining two words. So already we discussed the small words, sentences, they will tell in toddler. So small words, they will tell, completed small words, they will tell in the toddlers. So it is around 12 to 18 months of age. Which social emotional milestone is expected around 6 to 9 months? Showing affection. They will show affection to the caregivers. Next question, what is the typical age for standing without support? 12 to 14 months. Maximum we can wait to 14 months. Around 12 month, end of the infancy, they will stand without support. At what age do children typically start using simple sentences? 18 to 24-month toddlers. So they will talk simple sentences. So end of the toddler period means 18 to 24-month. They will speak simple sentences. Which cognitive milestone is expected around 4 to 6 months? Understanding simple commands. Which cognitive milestone is expected around 4 to 6 months? Understanding single commands means if the child is taking a ball or anything, if you are telling don't touch, maybe the child will not touch. So child can make out symbol, understand the simple sentences, commands. What is the typical age range for pointing to objects? 6 to 9 months. What is the typical age range for pointing to objects? During infancy period, the child will point out the objects. At what age do children usually start imitating emotions? 9 to 12 months. At what age do children usually start imitating emotions? So they will imitate emotions at 9 to 12 months. These are the main questions, but they will ask so many questions. They will ask in the milestones, maybe in the arthopometric measurements. So I think all of you understood. Thank you.